Doctor, can you please explain about the cervical cancer?
Sure. So, cervical cancer is considered as the commonest cancer in women in India. The breast cancer is the second most common cancer in India in women. Cervical cancer means cancer of the mouth of the uterus. The cervical cancer is caused in all cases by a virus which is called as a human papilloma virus. Now, the most reassuring thing about cervical cancer is that we are able to diagnose the cause of the cancer, which is not there in most of the cases. Like it is, we don't know why other cancers occur, but we know why the cervical cancer occurs. So cervical cancer screening has become very, very easy these days. What we do is we just take a smear from the cervix and we put it in a test tube and send it for culture. That is called as a HPV PAP. Not the routine PAP. This is a HPV PAP, human papilloma viral culture PAP. And if it comes positive, then we know that this woman is at a high risk of cervical cancer in the coming future. So maybe after 5 years or maybe after 10 years, she may land up in cervical cancer. So that gives us a very long time in which we can treat the patient, in which we can remove the cervix, and we can do a lot of things to prevent the cervical cancer. This is a very, very major health achievement as far as globally it is concerned. It has made the cervical cancer deaths come down by a big margin. The problem is that the test is slightly expensive. It's not very expensive. It costs around 2,500 rupees, but women are very reluctant to come and get it done. I would really want more and more women to go in for HPV PAP, HPV DNA, because it gives a reassurance. If it is negative, the woman is not going to be affected by cervical cancer in the near future. And this test has to be repeated every 5 years. So it is not that every year you have to come. It is good enough if you do it every 5 years. Another important milestone in this is cervical cancer vaccination, which is to be given to young women. It is a vaccine against the human papilloma virus, and the ideal age to give is between 13 to 26 years. The vaccine is to be given in 3 doses. It is given in 0, 1 and 6. That is the first dose if we take today, the second dose will be after 1 month, and the third dose will be after 6 months from today. And that is also shown to be promising, though it is a new thing, only around 7 years since we have started vaccinating girls, but yes, at least we have got something to offer. As far as the elder women are concerned, I think there is a grey area whether we should vaccinate or not, but we can individualize the case. But between 13 to 26, yes, we should give vaccination to them.
Okay. And doctor, what are the symptoms of getting this cancer?
Cervical cancer, like all other cancers, the symptoms come very late and they are very non-specific. It is true to all cancers, may it be cervix, breast, ovary, the symptoms are very vague. Now the cervical cancer symptoms will be white discharge or bleeding after intercourse or intermenstrual bleeding, that is you get bleeding or spotting between 2 menstrual cycles. Now these are also common in a lot of benign cases like in infections, like in cervical erosions. So it is like I said, the symptoms are very vague and we cannot say that these are because of cervical cancer. More often than not, people worry, but they are not because of the cervical cancer. And mostly till stage 2, there are no symptoms, and that is the worrying thing.
Okay.